Hi, my name's Alan Johnson. 20 years ago, when the LIFT project began, I was a local Member of Parliament in Hull. Now, 20 years later, I'm the chair of City Gear, the LIFT company in Hull. And in between, incidentally, I had a couple of years as Health Secretary. So I've seen this project from different perspectives, and everything I've seen has been good, because what LIFT has done is transform primary care.
I have personally been involved in the NHS LIFT programme since 2004. During that time, I have been privileged to be able to play a role in developing and driving up to 14 public-private partnership LIFT companies that have been so integral in delivering improvements in primary healthcare and community estate across England.
I've been involved in the LIFT programme since 2003 as part of the Prime UK Developments team, where we have delivered over 25 community assets in the Midlands area since that time.
For me, LIFT has always been about much more than just new buildings. The focus has been on improving local healthcare services for patients, innovation and wider community benefits.
What I like about LIFT is how the team operate differently. The team engage with the local community and the local health environment and want to support them in achieving their health outcomes.
LIFT has made a huge difference in St Helens. The quality of our LIFT estate is really good, and that compares to our non-LIFT estate, which needs a lot of work and is not always fit for purpose.
I've been involved in LIFT since the very earliest days and have chaired 5 LIFT companies over the years. The thing that strikes me most strongly is that we've delivered nigh on 340 buildings at a cost of £2.5 billion, the vast majority of them on time and all of them on budget, and delivering excellent value for money.
For me, what I'm most proud of is the fact that I come to Graceville Gardens here, and it's a real community building, it's a real community feel, and it's a continuous journey. So even we've got work here at the moment thinking about how the world is changing and how this building can adapt to deal with that change.
Our long-standing team, some of whom have been with us right from the beginning, have built up a huge knowledge base of our primary care framework, which has given much needed stability and continuity in the ever-changing world of primary care delivery.
Many of those who were involved in the original setup of the model are still very much involved today, and I think that that's because they're proud of what the model has achieved.
What I am most proud about is the 350 buildings that we have developed in partnership. They're integrated with local authority services, and they also start to address well-being and the health of local communities. So we may have a leisure centre associated with the building, we may have libraries, we may have housing, we may have a football pitch.
Within the local community, there was a high demand for valuable services to be provided at the Nelson Health Centre, and together with LIFT, CHP and local community engagement were able to determine the services were going to be delivered from the Nelson.
The private sector partner with the NHS, the Outright Group, sees this as a perfect fit with our ethos to work closely with communities, and we work tirelessly to ensure that these buildings add value to the local community that they serve.
LIFT has a great role to play in making sure that what the primary care networks are able to do in the future is going to have the necessary premises to accommodate them.
The building is just an asset. The biggest asset is what's in it, and how many people we can get into that centre. And they're all vast majority of these LIFT buildings are right in the heart of our communities.
As a primary care network, we're really looking at bringing services together and working with our community partners. Through using the LIFT building and the rooms that it offers us, we can work closer with community services and with our practice services to deliver care not only to our populations within each practice, but to the communities that this building serves.
The buildings that we have created since 2007 have really brought health provision at the primary level into the 21st century.
Today, the LIFT programme is about so much more than just developing new buildings. And to make the most of the learning opportunity that the coronavirus has brought us, we need to continue to work together.
There's integration of different types of services on large buildings, and also from my perspective is they replace a lot of rundown terraced houses that have been converted that weren't fit for purpose.
Hopefully we can make these buildings kind of really key community assets that do everything that we imagined that they would be able to do, and that people come to because they want to be part of them.
There is lots to be excited about for the future, despite the challenges that coronavirus has thrown at us. This challenge could be an incentive to finally move many of the services currently based on hospital sites to either a digital platform or to the local primary and community lift estate.
Lift as a project was groundbreaking, continues to be groundbreaking. There is more to do to improve primary care and much more to do in terms of the kind of public-private partnership that has done so much to improve people's experience of the NHS at local level and community level.